Hi, I'm Kripa. I'm working as an Assistant Professor, Department of Orthopedics, Dr.M.G.R. Educational and Research Institute. Today we are going to discuss about this hydrolyzed table, and this is the table can be used both for treatment session and also for relaxing the patients and for manipulation techniques. And this is highly motorized, and this gives less stress over the therapist and also over the patients. So this is very helpful for treating the patients, and even the patient feels very relaxed because they no need to strain among themselves. If you want to reduce the height of the table, we can reduce it, or if you want to elevate the table, we can elevate the table. And this consists of three sections. This is cervical, this is thoracic, this is for the lower limb. So if you want to increase the height of the table, this is the remote, we can increase the height of the table. Okay. Then if you want to decrease the table so that we can place the patient, if they are very geriatric, if they feel very difficult to rise over the couch, it will be very helpful so that we can reduce the height of the table, we can place the patient, and then we can start our treatment. And again, this has three sections, in which this is the cervical region, in which in this we can remove this, we can place the patient in prone position, and so that they can feel very easy for breathing purpose. And this is also adjustable. If you want to raise the head, we can rise like that and we can place it, or if you want to decrease the height of the cervical, we can do like this. So that if you are about to increase the blood circulation for the cervical spine or head region, we can utilize like this, and then we can replace like this also. And if you want to take arm rest, if you want to support the patient, if you want to place the patient in prone position, relaxed position, this is the arm rest, which is also adjustable. So this is a pelvic wedge. You can see the difference. So without asking the patient to make the changes, or so that we can motorize it, we can lift the table like this, we can make some changes in the pelvic region or in the lumbar region, and we can do the manipulation. And we can reduce the modifications also, so that we have less stress for therapists, for both the therapist and both the patient. So now we are increasing the height of the table. And then if we want to do pelvic tilt, position the patient, we can do the pelvic tilt alone. Like this we can do. Okay. Then if you don't want to reduce or adjust the height also, we can do. So another benefit for this table is, this table can be used both for treatment purpose and also for giving traction. So the main benefit is that we can easily mobilize the patient and without disturbing the patient. If you want to raise the height, or if you want to specifically give traction for the specific spine also. This is a table, we can utilize both for positioning the patient, for manipulation techniques and mobilization technique, and also we can use it for the traction purpose. So for the traction purpose we have more accessories. So here in this is the part, this is the accessory in which if you want to flex our hip and knee joint for specifically give traction for the spine, we can utilize this. This is the cervical support in which we can utilize this for treatment purpose, for manipulating the cervical spine. Going to demonstrate this table with the traction, how it is working with the treble. So this table, it has a power grip. So if you have another table is fixing, the fixation will not be that much power. But here it is a power grip for a chest and for lumbar region, for lumbar traction. So this is the traction machine. We are going to on this. So first we have to select which is cervical or lumbar. If we want to give lumbar, we can select like this. And this is a knob for selecting. If you are doing like this, it will be selected as lumbar. Then you have to press the button valid. This intermittent, so we are giving valid for intermittent. Then traction force, so minimum force is 20 kg. If you want to add kg, we can increase 25. Okay, then we can give valid. Treatment time is 15. If you want to increase also, we can 16, 17 or 15 minutes, we can adjust like this. Then hold time is 20 seconds and rest time is 5 seconds. Now it's starting. So this is given for the knee flexion. So before on we have to ask the patient, or we have to search for the footrest or anything stool. We have to bend our hip and knee to this degree. But in this table we have the accessories, so that without any help or without any stress on the patient, we are giving this accessory so that it is flexed for knee joint and also for hip joint. So it will be, the traction will be very specific to the spine. Now we can demonstrate this lumbar spine traction, how the force has been pulling. This table is very useful for treatment purpose, demonstrating purpose, traction. It's a multi-purpose table. Even it can be useful for manipulation techniques. And this is very useful for both UG students and PG students and for doing research projects. Thank you.